what have been the typical autoimmune cases that you have seen in your clinic, and what has been generally your line of treatment, and how soon can a person see benefit or cure?
Right.
Like there's Hashimoto is another
Yes.
thing that
Yes.
is very common.
Yes.
There's psoriasis, which is very common. Some of it is just irritating to the person. Some of it
Right.
is extremely debilitating to the person.
Right.
So how do you have different lines of treatment, or how does it work?
So Karan, first of all, we get a lot of autoimmune patients today, whether it's Hashimoto's, whether it's psoriasis, whether it is any kind of joint-related issues. And all of this, or leaky gut for that matter, or Crohn's disease, all of this can be easily reversed by Ayurveda. Yeah, number one, because it's an overload of toxins in the body, and not just overload of toxins. It has gone up to that extent where any amount of medication is not going to help, and the allopathic system cannot detox. Okay, a lot of people do these vegetable juice detox or fruit juice detox or eat fruits. That's not the way to detox, because in Ayurveda, when we talk about detox, we have to go into the cell. We have to cross the blood-brain barrier, and a single cell has a cell wall, and then it has a nucleus inside. Now, it also has mitochondria and DNA and chromosomes inside. Now, this cell, nature is so beautiful and our body is so perfect that it takes a hell of a lot of effort to actually penetrate that. There is no allopathic medicine which can actually penetrate into the cell. But Ayurvedic medicines, because it's herbal and because it's adaptogenic, can easily pass through, because the cell is natural and it allows anything which is natural to come inside. It welcomes it. Okay, so we can go into the cell, remove all the toxins from inside, or this armor which is there from inside, and then the cell starts to perform its duty, gets back its memory, and then it becomes a beautiful normal sur, or it's not a zombie cell anymore. And that's how we treat. And that's the treatment for every individual is different. Since you asked the question that how is the treatment? In fact, if we have 8 billion people on the planet with 8 billion the same disease also, or 8 billion diseases, we will have 8 billion protocols. So we cannot have the same protocol for any two individuals.
So what is the first, like, how do you test for whether it is autoimmune? Is it like some nadi shodhan, or do you what are the typical signs a person should notice before when he says that he must come to you, and because it may be autoimmune? What do you think he needs to look out for?
So there are, the body starts to show signs probably 10 years before you have an autoimmune. Okay, it's just that you've been ignoring it, right? Now, when, for example, let's say in Hashimoto's, the thyroid gland is starting to slow down, or it's starting to get overactive, then you've not paid attention to it. But in fact, what would probably happen before is you've been sleeping late, waking up late, you've been eating trash, or you've been probably having dahi every day, okay, which can create chokes in your channels. So that will create some kind of issues, like even a simple headache, a lot of constipation for long periods of time, years of constipation, not being able to evacuate properly on a daily basis. Okay, these are very, very strong signs that you're moving towards a serious disease. There can be aches and pains of joints, like when you wake up in the morning, you feel this joint pains in your fingers or below your feet, and for the first few seconds or few moments you're not able to walk properly, but then after 5 minutes you're fine. So these are signs. Okay, the third can be having headaches on a regular basis. Okay, and not figuring out what is the reason you have these headaches. So these small issues probably you've had for the last 10 years has then it pushes you towards a certain autoimmune. It can, or any kind of addictions for that matter, yeah, alcoholism, or can lead to several autoimmunes. Smoking can lead to autoimmunes. Then people have no idea. People think they're only cardiovascular issues or lung related issues. No, not necessary. There can be all kinds of addictions can lead to, even chocolate for that matter. People think chocolate is harmless and it is it's healthy, especially dark chocolate. It's not. It actually if you see under a electron microscope, when you eat it, the moment you eat a chocolate, the blood vessels in your body, it dilates but 10 times the size. A normal size, it dilates 10 times. So imagine you eating this chocolate every day, or 3 times a week, or twice a week. So if it goes 10 times, now there's some elasticity to your blood vessels. What happens eventually to such people is your capillaries, or we call it dhamanis, they start to become crooked. And nothing in the world can actually make them straight again, or how they were again. Yeah, so that's where Ayurveda comes into picture. Like, I don't think allopathy has any ways of doing that. Then they'll just give you steroids, or they will give you, which is really detrimental for your health. So what we do is we then change your lifestyle. We stop the root cause of the disease. The main idea of any nidan, a proper nidan by any Vaidya, is to find the root cause of the disease. So once the root cause is known, then it is very easy for us to actually treat the patient. And in Ayurveda, we know ways by which we can straighten out these capillaries or dhamanis. We know how, by giving bastis or specific medicines. Like I said, the cells just welcome the adaptogenic and herbs, because the moment you take these kinds of herbs, within, we've seen cancer patients, in fact, within 15 days of starting our medication, starting to feel relief. We have patients who have had serious pain and health issues within a span of just 5 days or 7 days of taking our medicine, and they have relief. And people have a misconception that Ayurveda is slow. It's not. In fact, it's much faster than any kind of other medication. Yeah.
So because other medication is actually just managing it, it's
exactly.
not curing it.
And people need to understand this, that in allopathy or in modern science, what they do is there is a certain dose that needs to be given. What is that dose? That it has to push into the cell, or it has to push it, because the body is not accepting it. You put a small amount, the body doesn't accept it, because it's a natural thing. The body is nature, and it doesn't accept anything unnatural or artificial or superficial. So what does it do? It rejects it. But we have to push in a larger dose so that at least something goes into the system, and it is made bioavailable. That's why you have this concept in allopathy which says it should be made bioavailable. Whereas in Ayurveda, you give even so much, it's made bioavailable. It's easy because it is already bio, right? It's a natural thing.
And I think there's somewhat similarity in homeopathy as well. In
yes.
Which, contrary to allopathy, homeopathy believes in doing 1/100th, 1,000th of the medicine. And,
exactly.
It obviously breaks the cell barrier.
That's
and goes in.
Yes.
So there are sometimes portions.
Absolutely.
You mentioned a little bit about thyroid. I think that is something which it's almost an epidemic now. To have any of the
especially
popular,
women. I think.
Yeah, like the thyroxins of the world or the drugs of the world, and I think people keep increasing their dose.
Yes.
There is very few people reduce their dose. They every time they go to the doctor, they're told to go from 25 mg to 50 to 75. What is your general, if you focus a little bit about on this thyroid and
so thyroid, conditions like thyroid or Graves' disease, or which is also thyroid, or Hashimoto's. Now, Graves' disease is also an autoimmune. Hashimoto's is also an autoimmune, which can eventually lead to cancers also. Like Hashimoto's can lead to cancers also, or thyroid-related issues, which can, which cannot be sorted when it comes to allopathy, can easily be reversed just by Ayurveda. Now, a simple thing like, the moment you get a thyroid related issue, if you come to a Vaidya, he can probably reverse it in just 2 months or 3 months. But, what most of the people do is they will go to a GP to take a thyroxine and then prolong it for the next 10 years, and then when their dose increases, then they'll come to us. By the time, it's a little difficult. We can still do it, but it's a little difficult. But there are ways through lifestyle changes, through dietary changes, medicine. Then of course there is Panchakarma or detox, by which we detox the cells and the ama in the system, which is exactly the reason why they have got the thyroid, and yogasanas. I would just like to give a tip to every thyroid patient here that there is a yogasana called Sarvangasana. They should do that every day for at least 60 seconds to up to 2 minutes, or sometimes even a little more if necessary. So Sarvangasana is something we recommend to all thyroid patients. Yeah.